Today's session is the guest session, and as you can see on your screen, we have Madam Revati Mani, who is the Chief Operating Officer of Pavana Hospital, and she will be sharing this topic and discussion, leading the discussion today. The topic is called Implementing Nursing Empowerment. So, before I introduce Madam and her stellar career, let me give a little background to this, why we chose this topic. I think I do this for every session, and it is also important for us to understand why we are selecting this topic today, or why we have selected this topic today. So, the NABH in 2021 is now a 16-year-old organization. It was started in 2005, and 2006 onwards they formally started the accreditation program. So, from very beginning, we have been hearing about nursing empowerment, and every hospital I have visited and every hospital that you all have seen, they all say that we have implemented nursing empowerment greatly. But despite 15 years of implementation of nursing empowerment, we find, and at least I find in a lot of my practice, initially as a principal assessor with NABH, and now in my consulting practice, I find that though everybody says that they have implemented nursing empowerment, but the on-ground situation is different. The kind of implementation that is necessary is not visible. Okay, so therefore we thought that we will take this topic and talk about it, because unless we talk, we will not understand the nuances of implementation. That is the reason we are here today. And now let me give a brief introduction of Madam, who is here with us today, and who has kindly consented to be the faculty for today's program. So, Madam is the Chief Operating Officer of Pavana Hospital in Talegaon Taluka in Pune district in Maharashtra. She is a graduate in nursing and sociology and has done everything that you can do as a nursing professional. So she is a postgraduate in nursing administration. She has done a course in medical legal systems. She is actively involved in hospital administration and also has an MBA degree in healthcare administration. Nearly 40 years of long experience. I'm sure that's very valuable, and we all will get to learn something from there. And also she is the assessor for NABH accreditation programs from 2009. So she is assessor for hospitals. She is assessor for SHU entry level, PHC. I mean, lots of programs. So I think whatever I have said doesn't really do justice to her, credentials. But let me put it in one line, that it is good that she is here with us today. And being from the nursing profession, I think she will add a lot of very clear concepts to our understanding. So with that, I hand over you to Ms. Revati Mani Madam, and she will lead the discussion, and I'll assist her in running the PowerPoint work. So let us begin.
Thank you. Good afternoon, everyone, and happy Onam to all my friends. Of course, being Onam today. Sir, can you hear me?
I can hear very clearly. Don't worry about it.
Yes, sir. Yes, sir. Thank you. So I'll let me just say a few words about nursing empowerment. So the nursing empowerment to ensure timely nursing care of patient, involving them in a decision-making process, job incentives, encouraging innovation, supporting education, promoting interpersonal relationship. They are encouraged to participate in organization decision-making groups and committees. There is a commitment to support and reward nursing staff from time to time. Nursing professionals at the bedside participate in plan to treatment till the discharge of the patient. They ensure that about the patient safety and risk management issues are an integral part of a patient care and hospital management. So today we will be talking about implementing nursing empowerment. I'll go according to the books because I have taken from Nursing Excellence as well as NABH book, 5th edition, because NABH is the institution which has changed the nursing perception and enforced the healthcare organization to put on a paper as a SOP. So hence nurses can be formed to work accordingly. That is what I think. So sir, the introduction wala. So the scheme of presentation will be introduction, purpose and why it matters, essential elements for empowerment, factors contributing to nurse empowerment, role of nursing leaders in nursing empowerment, and the challenges. We will go through all those things. Whatever the questions are there, we can take it later because it's a big topic. So what little bit, whatever we can put it, add it on this, we have done it. But whatever questions you have, I know that you will be having lots of questions, so that I will take it later on. Okay, sir. Yeah. So in the introduction, we will see the hospital. The hospital work environment is constantly changing to keep up with technological advances and to develop strategies aimed at providing quality and safe care to the patient. So in present modern era of technology, patients are more educated and have accessibility to information. They go to Google and they find out lots of things. Hence, demand for quality care is higher. This has led to great change in the nursing career. The responsibility is greater to provide complex nursing care, making it necessary for a nurse to be empowered. Nursing empowerment improves healthcare and the patient outcome. Next, sir. So we'll go to the definition. Empowerment has lots of definition as whatever you take it, like a positive concept of power or authority for doing something. So the nurses has been given that empowerment, that is a power and authority to do something. It is also associated with growth and development of a person and the organization. So individual can have their growth and their development. Critical thinking on own thought, feeling and reason for action and in the pattern of activity are also in empowerment process. So a process of sharing the power with enthusiasm. In general, empowerment is the process by which individuals strengthen or develop skill to promote positive changes. That is what I think. Sir, one more slide is there on definition. Rakesh sir. Yeah. Empowerment in working place provide the chance to learn and grow. So the nurses will learn there and they will grow through the access of information sharing, support, opportunity for advancement and the resources, whatever they are getting it. So now we'll go to the nursing empowerment. Nursing empowerment to effectively motivate and mobilize self and others to accomplish positive outcomes. So basically it is motivating and mobilizing to get a positive outcomes in nursing practices and the work environment. Instilling a sense of power by granting decision-making authority and or creating opportunities to influence decision and providing ability to make choices. So we are giving them the decision making authority so they can take their decision whenever there is a patient care is involved. So the empowerment of nurses contribute to greater professional satisfaction, decreased burnout rates, and increased autonomy and organizational commitment. In addition, it positively impacts patient safety and quality of care in the healthcare. So what is the purpose? Purpose is to protect patients' rights, to demonstrate and promote autonomy and assertiveness in problem solving for patient care, to enable decision making in relation to patients' healthcare needs. Can you hear me, sir? Sir?
Yes, we can hear you clearly.
Yes, sir. Yes, sir. So these are the purposes why we need to have a nursing empowerment. And what does it matter? As a frontline care provider, nurses has the most direct knowledge of the practices that drive patient satisfaction and well-being. They are the first person whom the patient will be interacting with. So the nurses have access to first-hand data and the information. So they, whatever the requirements are there for that particular patient, they can utilize the time, they can utilize the material, and they can provide the staff according to that, which is more effectively it is been done, and it will be patient will be very happy with this. So better patient outcome by timely and appropriate intervention. So the intervention time is very less. As soon as the patient comes, the assessment has been done. They know what are things are required. They have informed the clinician. Everybody is done. So the work time is very less. Entire material, the staff, skilled staff who are required for that, the job has been done. So now, for what are the contributing factors for all those things? So first thing is the decision making, control of nursing practice within an organization, being a part of a decision relating to nursing budget, equipment, planning, skilled nurses, inventory, deployment of manpower according to their skills. Like example, in ICU, the ICU trained nurses can be put, material inventory everywhere, whatever the material stocks, how they are doing it, inventory and everything. So entire decision making, which is my ward and what all things I'll be requiring it for my patient care, that is more important. Second is good communication. There should be open communication among everyone, patient, nurses, doctors, and the healthcare providers. So there is open communication from the starting, from the admission till the discharge. And you can see whatever the barriers, whatever the doubts the patient has, you can communicate to the patient, you can communicate to the clinician, and see to it that the whatever they have like doubts and misunderstanding is cleared. Nurse physician interaction, yes, this is a major problem. I won't say it is a problem, it is a communication. So whatever the nurse is feeling, that whether it is required immediately or little later, or whatever the patient she has seen, she has to communicate to the patient, to the clinician, and the physician interaction is been done. The third is autonomy. Autonomy is ability to act on the basis of one's knowledge and experience. Whatever knowledge they have, according to that knowledge, they will have to, nurse has to be competent enough to take a charge of that particular situation. Manageable workload, reasonable work assignment, like ensure you have enough nursing staff. We have all the hospital will have, like, shortage of nursing staff. So you have to see that, ensure that you have enough nursing staff. Create a positive and supportive work environment for the people who are working. Help nurses to prioritize what is first, what is second, what is third, we need to do, how we have to prioritize the patient. Create consistent processes, policies and procedures. Support better management practices. Fifth is the reward and recognition. So appreciation received, whatever appreciation is received is been well taken, so which increase their individual productivity, increase engagement among their colleagues, are more likely to stay with the organization, satisfaction from customers, have better safety records, and there will be very less incidents. So there are three empowerment components. First is a workplace that has the requisite structure to promote empowerment, a psychological belief in one's ability to be empowered, and acknowledgement that there is a power in the relationship and caring that the nurse provides. Structural empowerment, according to Cantor's theory of structural empowerment, includes a discussion of organizational behavior and empowerment. According to his theory, empowerment is promoted in work environment that provided access to information, resources, support, and the opportunity to learn and develop. Then comes a psychological empowerment, a sense of motivation based on the dimension of meaning, competence, self-determination, and impacting patient care aim. So it is related to sense of motivation toward the organizational environment based on the dimension of the meaning, competence, self-determination, and impacting patient care aim. could be used as both as a positive outcome both for nurses and the patient. Empower in working condition increase feeling of psychological empowerment in nursing for better health outcome for the patient. Improving abilities, we have four abilities which we can call as an enhancing leadership skill. Be a positive change agent, get certified, be an evidence-based practice cheerleader. So we'll go one by one. Enhancing leadership, encourage to participate in leadership and management program, formal or informal opportunities to shadow nursing leaders. So the nurses can be with the nursing leaders to learn many things like a buddy system, participate in a committees that make decision and policies that impact nursing role. So when you are participating in committees, automatically whatever standard operating policies have been formed or management related issues or pharmacy, entire thing you can talk to, you can be in that committee. Develop global view of leadership styles, develop rapport with organizational leaders, and attend insight into how the organization operates. Enroll in leadership continuing education. This is like you need to understand that how you are going to empower the nurses. In one of my organization, there was a leadership development initiative or a nursing leadership initiative, which they used to train all the nurses, and the nurses can become a facility director for one of the organization. So they make them train so much with financial, with materials, with everything, so that with the nursing they will have all the facilities which they will learn. So according to that, there are hospitals in India who promotes nursing empowerment. So when they have to enroll themselves in a leadership continue education. Next, sir. So positive change agent, find areas for improvement. Suppose if you find any of the areas where you need an improvement, so increase the efficiencies there, find out what is the problem, how we are going to do it and improve the patient outcome. From work group or committees, these allow collaboration to accomplish specific tasks. According to there are many new protocols which has come now. So all those protocols which we have to follow. So it is not that only one person can do that. It is the entire system which will work for a patient safety. So these are the things which you have to improve in your own organization. Third is certification. There are many specialty certification which has come, which where you can go up till that level for your expertise. So makes individual move more invested in the success of organization, improve efficiencies within the team. I'll give you an example. There was one nurse in one of my organization who was cardiothoracic nurse. She has done her masters in cardiothoracic, but at the same time there were in my hospital one of the patient who was put ICD, intercostal drainage. The indication was not appropriate. So she went and she talked to the intensivist and said that what was the indication? Why did you put an ICD tube? So the intensivist did not like it. He said, who is she to ask me? The letter has come to me later on saying that she is involving herself in all clinical areas. Please ask her to stop or don't send her in the ICU at all. These are the things which happens in our area, in the nursing area. So if you have particular specialty certificate, see, nurses are already, they are trained. Some of the things which has been 3.5 years, they have done a training, or a 4 years, they have done BSc, 2 years, they have done MSc. They are already trained in a basic nursing qualification. So there, they don't require an empowerment. They have to have an empowerment in all other areas where they are already, they know about it, what they are supposed to do. They are licensed. They have a license from the nursing council. So they can work according to their book, according to their or what you say, according to their lessons. So they are very good in that. But according to that, more than that, if you have a certification for a particular particular area, then it is much valid. So that is the investment where, the hospital will also gain more and more success. Patient outcome will be very good. There will be less mortality rate. So it improves efficiency within the team, because she or he will be training the entire nursing team. So there will be efficiency in improving the team. Fourth is evidence-based practices. So what we have to do it, we have to evaluate. When nurses implement evidence-based practices, patient care outcomes are improved. Patient satisfaction with the level of care what they're giving, it is more. So evaluate data to find more efficient ways to perform tasks and procedures or provide patient care. Enhance their knowledge base by completing continuing education courses. There are lots of education in-house or external courses which they can do it. Attending workshop, participating in quality and audit activities. There are multiple things which are coming. Now everything is online, but otherwise also there are multiple things where if you want to improve your knowledge, you can always do that with this. Next, sir. So what is the role of a nursing leader? Creating a workplace that enables empowerment, open communication. They have to be very open. We need a nurse leader who not feel empowered themselves, but have the skills to empower the nurses they supervise. So you need to have an open communication, structured collaboration between nurses and other care providers, giving voice to the nurses, just culture, non-punitive, rational, fair work, culture based on a care objective. So what they need to do, they demonstrate autonomy. They are more likely to have independent decision-making skills. They can perform well without consent or constant feedback. They feel like stakeholders in the whole care delivery system. Empowered nurses are most likely to speak up about hospital policies and areas that needs to be improved. Creating structural empowerment, access to learning, CNEs, courses, seminars. They have to attend CNEs, they have to go do courses, they have to go for the seminars. Access to resources, learning resources, making time for learning. In-house, the hospital can have lots of learning session for their nurses. Support and promote knowledge, skill and competencies. Go talk to them, make them understand. What happens is in nursing, many times they are not very well versed with the language. Everywhere, whenever they go, they have a problem with the language. So the hospital, the nurse leader has to train them for at least 3 months for all the policies, processes, how the nurses have to work. And according to their skill and competencies, they will be putting it in that particular area to work. So they can give you more of output. Creating psychological empowerment, sense of motivation based on the dimension of meaning, competence, and self-determination. So you have to have some motivation for them. You will be motivating them for entire thing. You will give them a psychological support, because sometimes the nurses are very workload is too high because of shortage of nurses. They will be doing double duties, or they will be coming whenever there is an emergency and all those things. So you need to have some motivation for them, where they have that self, they can do their self determination. They will be very competent about what they are doing. Some of the examples which I have given, of course, everything it will be like according to their standard operating policies and procedure, whatever the hospital will be writing it, because each hospital is very complex. Each hospital is different. So whatever, whatever policies you make for that particular hospital, you need to follow that. So ensuring safety of patients by ensuring appropriate hand hygiene techniques, because as soon as you have a hand hygiene techniques, your infection rates are going to go down. So hygiene technique by colleagues, physician, and other staff. announce various emergency code based on a situation. They need to understand what codes are used, how you have to work for that particular code, what is your role for that particular code. Initiate CPR based on a condition of the patient. So whatever, whenever it is required according to the patient's condition, if you need to give a CPR, how are you giving? You are you trained to give CPR? Have you undergone BLS or ACLS, whatever course? Administer certain medication without the need for a physician prescription. That is also as per the hospital policy. Participate in patient triaging and escalate immediate requirements to physician and senior nurses. You need to understand what is the triage means. These are the things which the nurse leader has to train her staff. If somebody says that this nurse doesn't know how to give a hot water bottle, so you remove her, it is not that nurse's fault. I will say that it is a nursing head who is responsible for her not giving her proper training. So participate in patient triaging and escalate immediate requirement to physician and seniors. Counsel patients. Audit infection control practices for all healthcare workers. Voice out any incident of misbehavior, misconduct at workplace. What happens is nurses don't come out if there is any misbehavior or there is any misconduct or incident. You have to give them that voice that anything goes wrong, anything happens, please, you have to come out and you have to communicate to the nursing leader or your senior person so that it will be easy to handle them that particular situation. Define and implement nursing care plan, carry out nursing assessment. So from the time the patient comes inside the hospital, the nursing work starts. She starts doing her assessment. So assessment, according to the disease, she will be making her care plan, and she will carry out those care plan also. Administer certain treatment, administer oxygen, cold sponging, pain medication, change dressing, administer 25% dextrose detection of low blood sugar level. There are multiple things, examples, there are multiple. Each organization has to empower their nurses what they are supposed to do. So when you make an empowerment policy, you need to write it where then what all the things that nurses can do in your organization. In one of the organization when I have gone, there was a CABG patient post-operatively. Patient came to post-operative ward. Patient came, I was standing there, patient came to post-operative ward and immediately patient went into cardiac arrest. So entirely the curtain has been put, the privacy has been given and the nurses started doing their job. I could see the anesthetist whom they called is coming very coolly. So I asked, my God, the patient is just CABG operated and the patient is gone into cardiac arrest. You are so cool. He is telling me my nurses know what they are supposed to do. Before I should reach there in the post-op room, the patient would have been revived. That is empowerment. That is empowerment. Manage pressure ulcer based on a pressure ulcer's risk assessment. Same time, fall risk assessment also you need to do. Now, there are nurse practitioners' job, which is there internationally, which has not come into India yet. But for that, you have to have a require additional training and certification by the Nursing Council. When it comes to India, it will be from the Nursing Council. What they can do, they can practice independently. They can prescribe medications. They can do audit. They can train people. You know, there are different kinds of training. One of my friend who is in UK, she is a diabetic doctor. So all HbA1c, whatever comes, wherever they require her, they send all the physicians and the patient to her. And she manages entirely independently. She can practice, she can prescribe the medication which can be given to the patient. She can do audit. She can give training. And she can counsel the patient. She can tell the patient how they have to go about it. Sir, the next slide. They are the advocate for the patient and they get involved in training of new staff. doctor, nurses, other professional, because there are different kind. Some people are working with the physician, some are nurse physicians, like that. Next one. So where are the challenges which we face? I mean, whatever here, whoever are there, they must be facing these challenges every day, in and day out. Level and quality of education. There is in South, when I was there is one particular college. They had this 3 BHK flat where they have started this nursing college. They used to go to one of the hospital for their training, but they, all boys and girls, they were standing outside because they were not allowing them to touch the patient. So where are we? What is the level of quality education? Inadequate bedside exposure among new nurses. There is one nurse who told me that I have done nursing education online. Then I said, how are you going to give IM injection? Where are your, which muscles you will give IM injection? So he said gluteal, and showed me deltoid muscles. Like, where are we leading? So very few colleges where are really good in India. There are multiple colleges, very few, I won't say, multiple colleges, very good, very good. I mean, you cannot even touch them, they are so good. At the same time, the level of quality education, bedside exposure is tremendous. It is too good. Some of the areas, it is poor remuneration. I do a rural development. I work for a rural hospital. So people will come to me who are not trained. So what remuneration, how do we give remuneration to them? What remuneration we have to give them? There are still, we have to give them the particular, which is according to the law, but then their involvement will be very less. Staff shortage, always there will be a staff shortage. And in rural area, nobody wants to work, everybody wants to go abroad after 2 years. Lack of senior leader support. There should be, I won't say in recent, now we are in a better position because the leaders are all qualified, they are all experts, they are doing so good for their subordinates, their staffs. I have seen many of them who are there with even NABH. They are too good. Sometimes the leaders themselves are unaware whether to do this or not, whether we need to take permission from the doctors. If the doctor says no, should I do it or not? So whether if I do something, whether he will shout at me, or what will happen to my nurses, or what will happen. Nurses are very scared. Next, sir. So there is a tendency to fix the system. Abhi ye ho gaya. This has been done. Now let me fix it. Whatever is, it is like just a corrective action at that particular period. What about preventing? How are you going to see that this particular system, I need to fix it properly? Rather than finding faults, ye isne kiya, ye usne kiya, rather than saying that this person has been done, that person, instead of that, let me see what is gone wrong. Let me do a root cause analysis. Rather than having a blame culture, this is not my department, this is your department. Pharmacy has not given the medicine properly, but the nurses has to see and give the injection, they have not given. So it is again a blame culture. Tune maine, you have done it and I did not see, I did it. So this is the major challenge in at least India, I would say. Very few hospital where everything is very nicely done, where the staffs are more, manpower is good. Many hospitals are there nowadays, which are really good, which we always see when we go for audit and all. So what we should do, empower the nursing leaders so that they can empower the nurses. Give everything. We need to give them that empowerment so that they will be very good and they will do very nicely. So that empowerment, they train them, internal, external, whatever. And like I said, leadership development or nursing leader development, those classes, they can be more empowered. Improve nurse doctor communication. At least the nursing head can take her nurses to a particular departmental head where she can introduce them to these nurses and say that this particular nurse will be working in this particular area with you. Communication should be, there should be some interaction. Have a get together. It will not take more time, 10 to 15 minutes. Jaise coffee with Karan ke jaise coffee chai with, you know, all the nursing heads, all the nursing people, they can come together 10 to 15 minutes and they can communicate to them, so the interaction will be more. Of course the clinician should have that much time to get, but it is all the nursing leader can do it much better than anybody else. So that is how the nurse and doctor communication will improve. But all those things, there should be active monitoring by the senior leader. Whatever risk, whatever quality, whatever the junior nurses are doing, whether they are following the correct policies and procedures or not, whether they are doing particular things, you don't have to shout at them in front of everybody. You can say that whatever you are doing, it is not correct. You can call them in your office. Even if the doctor is shouting some of the nurses, you can tell the doctors also that, you know, you can take them into one particular area and you can talk, or you can talk to me directly. I will communicate to my nurses. Let the nurses communicate more often to the doctors. Earlier in our time, like in 1980s and all, before that I should say that we were empowered. There was nothing written like this, but we used to do everything. Doctor nurses relationship was so good. As soon as the doctor asked us what is the condition of this patient, from the NBM, from the time how the patient's general condition, urine output, intake output, all everything, tuck, what medicine he is getting, how much IV fluid has gone, how much is the intake output, everything, it is one go we used to talk. There was nothing like, you know, you are empowered or you are not empowered. So we were already empowered earlier in our own field. So it was like working with them. The doctor nurse relationship was so good. Anything, as soon as they call us, we know what to tell them and how to go with them for rounds. Earlier days, we used to have these order books and all, where the doctor used to write it and you have to tick mark. Now everything is on Kaho, computer on wheels. People have, everything is very advanced, paperless hospital. As soon as any NC come, it will go to the nurses only. Entire NCs will go to nurses, and then there will be one more form which is formed and one more additional form which they have to fill. So many things has been related involving the nurses only. So the empowerment of the nursing staff is very essential, and nursing administration must understand the importance of empowerment so that nursing professional can lead the hospital effectively and facilitate the delivery of safe, high quality patient care in hospital. Thank you.
Is there any questions from anyone? Okay, so if there are no questions, let me add just a couple of words to what has already been said. When we talk about nursing empowerment, please remember that it goes hand in hand with credentialing and privileging. So all the privileging that you do is actually empowerment, and all the credentialing that you do is a verification of qualifications and the experience and the skills. So if you have done credentialing and privileging well, then you would have realized that a lot of empowerment is already in place. The question is, sometimes as the hospital administrators, when this question is asked, how have we implemented empowerment? So we start, counting. Okay, we've allowed them to do this, we've allowed them to do that. The better way to look at it is that based on the competence which will come from the qualification and the experience, how much privileging you have done. The more privileges you give, the more empowerment you're doing. So that's the only point I wanted to make, and it is not a new thing. It is just an extension of what Madam has already said. So thank you very much.